Hi guys, it's Dr. Ron Miller here with Pursuit Physiotherapy, and today we're going over, what are some basic fundamentals with lower extremity mechanics as you're running. And again, there's no correct way to run or right way that's the most efficient, best way to run. It's just, these are some basic fundamentals that you can implement or pay attention to help running a little more efficient or to help prevent any type of injury. So let's start from the trunk down. And we'll go through each body part and see, what type of motion should be occurring there as you're running. So first off, trunk-wise, you should have just a little bit of flexion going forward, just feeling like you're getting pushed forward a little bit. At the hips, you should be getting some hip flexion. This isn't a running like you're just running here like this, which you see a lot of times. You should be getting some hip flexion as you run. Maybe not to 90 degrees, but a little bit of hip flexion, and the other hip's going to be going into a little bit of hip extension with this. And a lot of times you see this, runners who have back pain are lacking the hip extension here because it's causing a little bit of compression here, but that's a whole nother lecture. So the knees, normally the knees aren't really a main problem. Something else is causing the knee pain. But one thing that I do want to go over is as you're running and you're about to hit your foot down, your knee should not be straight. It should be slightly bent, okay? So it's not flexed, it's not fully extended, but it should be slightly bent, and you should be landing on a bent knee, not a fully straight knee. And this decreases a lot of forces that are coming back up to help prevent a lot of running injuries with foot, heel, and ankle, everything. And then stride wise, okay, the most efficient way of running to decrease your rate of injury is to have a shortened stride and a flexed knee, okay? So we're not overstriding on a straight knee trying to reach out farther, okay? That shows an increased risk of injuries. What we're doing is having a shorter step length. Okay, so instead of my heel coming straight out there, it's landing right here with my knee slightly bent, okay? So as you're running, your stride should be a shortened stride with a faster step rate. This has been shown by a lot of literature to decrease running injuries and decrease your risk of getting an injury, okay? So your stride should be short with a faster step rate. Okay, now what you be doing with the heels, ankles, foot, and stuff like that? This is a big controversial topic, whether you should be a heel striker, a midfoot, or a forefoot striker. And nowadays, it probably really doesn't matter as much as we once thought. Whether you're a heel striker, it's not going to change your running efficiency. If you're a toe foot or a toe striker or a midfoot striker, it doesn't really change the rates of injury. Now, if you're dealing with an injury and trying to recover from it, that's a whole different animal. But if you're just an average runner or an elite runner or just starting out, don't pay attention really to whether you're a heel striker or a midfoot striker or a forefoot striker. As you fatigue anyway, most people go back to a heel striking pattern, but they still don't get injured. So your shoe type really and your striking pattern doesn't matter as much as preventing overstriding and having a faster step rate. Okay, so it doesn't matter whether you land with a heel first or a midfoot first or a toe first. What really matters in the lower extremity is decreasing your stride length and having a faster step rate. So instead of doing this, you're doing this and down, landing with that flexed knee with a shorter stride. So these are some general principles to follow regarding the lower extremity and running injuries, and some general guidelines of how to run. Please, if you like this video, share it on social media, subscribe to the YouTube channel. We have a running injury playlist that's specifically just for runners and running injury prevention, and we also have a closed Facebook group, Orlando Runners Therapy. That is, we go over content like this, have great discussions about running injuries and how to prevent them, and running training patterns. So until next time, thank you for tuning in, and I'll see you soon.